community supporting each other is that it's easier for us to be positive. McCormack Russell is a world leader in asset-based community development, and he really sums it up beautifully when he talks about addressing challenges by focusing on what's strong, not what's wrong. Our friends in the professional services, they're here to help us with what's wrong, and that's fine. But focusing on strength and opportunity and aspiration is vital. And it's easier. It's easier to focus on things. It's also actually best done by the community, not by a mental health professional. The place of medical professionals, psychologists, counselors, they are absolutely important, but the role of community, of family, of friends is just as important. So let's just take a quick step back and just sort of look at the state of mental health in Australia. So the latest data from the Australian Institute of Health and Welfare shows that 1 in 5 adults and about 1 in 7 young people experience some form of mental health challenge in a year, and they were looking specifically at 21 to 22, or 2021 to 22. So the way it broke down is that we were looking at 4.7 million Australians filling a mental health related script in that 1 year. Over $11 billion was spent by the government providing those scripts. And that works out to be around 7.3% of our total health budget. So it's significant. We also know that some migrant populations experience much higher rates of mental health challenges, while their understanding of mental health in certain communities remains stigmatized. Or simply, we've just got poor mental health literacy compared to what we believe to be basic and standard here in Australia. We also know that accessing professional mental health services is increasingly difficult, and waiting times are in fact blowing out. Now, in many ways, we've actually done a terrific job over the years to break down the stigma associated with mental health challenges, and we're definitely not keeping things in the dark anymore. So the figures that I've just quoted to you, I actually don't want you to see them as a negative number. I want you to realize that that's a reflection of how much more we're engaging with this challenge. It's not that we have more mental illness in our community. We're just far more willing to talk about it, to address it, to seek help out for ourselves and for others. And that's a testament to everyone in this room that's clearly here to support this cause. Prior to the epidemic, and I really thought I was going to do one presentation where I didn't mention it, but yet here we are, sorry guys. But prior to the epidemic, we had 1 in 100 psychologists not taking on new clients. 1 in 100, which is actually a pretty healthy number. In 2022, that figure actually changed to 1 in 3. Yeah, it's a big one. 1 in 3, big change. And that's according to our Australian Psychological Association. So I'm not talking worldwide, I'm talking really specifically about what we're experiencing here. Waiting times to see a psychologist are now between 3 and 6 months, and that's if you can get a booking. It's actually one of the reasons why I'm so thrilled that our new clinic is going to be opening at the end of this year, and we will also now be providing psychological support, cognitive and spectrum and behavioural assessments, because it means we will be opening with open books, because we need it more than we've ever needed it before. Psychologists and other medical professionals excuse me, are important, and there is no question we need more of them. But it's community. This is why I talk about this lack of service or connection to service. It's community that is more important than ever. And you, as part of the Jewish care community, are actually likely to be the most important protective factors in each other's lives. Recovery from a mental illness doesn't happen in a comfortable chair in a psychologist's office. That's not where it happens. Recovery happens in the community, in the middle of this room. That's where true recovery happens. It happens with the vital support of our friends and our family and our work colleagues. The education programs that are successful, education programs that Jewish Care deliver, within them I always compare mental health with physical health. And in particular, providing physical first aid, primarily because mental health first aid is first aid, and the mental health awareness programs are triage. It doesn't matter who is applying the Band-Aid. What really matters is that if you key people know where the first aid kit is, they have the basic skills to know how to stop the bleeding, and if need be, check for a pulse. We want to make sure that all people are trained and on hand to be able to administer that really basic first aid. Through our relationship with Jewish Care over the last 6 years or so, it's been intensely rewarding to see the unwavering focus that the team has had on providing strong foundational education. The first aid and the triage, that's what's been provided by Jewish Care to individuals, community groups, school groups and organisations. And I know I keep talking about community. So what is it about community really that is so important and so powerful? Beyond the concept that we just understand. Community equals togetherness. It goes deeper than that. When I was preparing for today's chat, I was really reflecting on the concept of reciprocal altruism. And reciprocal altruism is this idea that helping others, we will always help others knowing that when we need help, it will be there because I have offered it in the past. But on reflection, I'm not sure if that's the highest ideal that we could aim for or even provide the best outcome with the most benefit. I think I would prefer to say to you, focus on the idea of paying it forward. And that's supporting others really without the expectation of getting something back. In fact, encouraging others to pay that favor forward on again to somebody else that has far more power and potency. Altruism is embedded in community. Altruism is selfless concern in action, and it's an action that might even come at a cost to yourself. Altruistic action is motivated by genuine concern for other people, without the bells and the whistles, without the applause or the pats on the back that so often we want. It's just a simple gesture of concern. And I really truly believe that if we take this altruistic approach to helping others by not worrying about ourselves,